Is there a connection between your blood sugar and the health of your spine and nerve system? Stay tuned for that answer coming up on the next episode of Ask Dr. McCord. Welcome back to this episode of Ask Dr. McCord, where we're going to talk about the health of your blood and blood sugar numbers and your spinal and nerve system health. And this month happens to be the American Diabetes Association month of the year, where there's an awareness about diabetes. Diabetes is affecting a lot of us. Actually, according to the numbers that have come out since 2000, that 1 in 3 men and 2 out of every 5 women that are alive in 2000, in the year 2000, this was 18 years ago, that you will contend with this condition called diabetes. And so it is the 5th largest disease process that affects our population here in the United States. And the average person may not realize this, but your overall health of your spine and nerve system can really impact how your whole body works, and specifically how your pancreas and your blood sugars work. And let me show you by using this illustration, this poster here that talks about the autonomic nerve system. And that's one of the key nerve systems that run your whole body. And in chiropractic, we talk about the brain-body or body-brain connection. And basically, you can see here the brain is enclosed in the skull, and the spinal cord, which is an extension of the brain, courses inside your vertebral column, which is made of 24 movable bones called vertebra. And in between each vertebra, there's a structure called a disc, which allows for mobility and flexibility. So due to physical impacts and stresses, the vertebra can actually shift. And if you trace down here right to about this level, you'll see the nerves come out of here and go right to the pancreas. So we're going to talk about some actual studies that have validated this whole connection between your spine and nerve system health and how it can influence your blood sugars and particularly your pancreas. There was a study that was actually done. Oh, and by the way, you know, one of the groups of people that actually get this the most are electricians. They can really understand this because if there's an interference to the connection of an electrical system, it's going to affect the function of what that electricity will go to and function as. And so people understand that when you understand this connection and how the anatomy and physiology of the body works. And there was a study done not too long ago that was actually published in the Journal of Vertebral Subluxation Research that has showed the positive effects of chiropractic when used with an integrated treatment plan and a medical doctor to treat blood sugar issues. They had found that one particular patient that they had tracked, after 1 month of being on the program of utilizing chiropractic care and also following what the medical doctors did, that actually their blood sugars normalized and became and remained stable. And the medical doctor who was monitoring this said this patient would not need insulin if the condition remained stable. And so that person's health was actually influenced by the chiropractic care and realigning the vertebra. Canada is actually leading a lot of the research in this. The National Post did a article titled Diabetes Breakthrough, where they found a discovery that even stunned those behind it. The scientists at the Toronto hospital say that they have proof the body's nerve system helps trigger diabetes, opening the door to potential near cure of the disease that could affect millions of Canadians. They first did a study on diabetic mice. They actually become healthy virtually overnight after researchers injected a substance to counteract the negative effects of malfunctioning pain neurons, which are basically nerve cells that go to the pancreas. Dr. Michael Salter said he couldn't believe it, and he's an expert at the Hospital of Sick Children. Mice with diabetes suddenly didn't have diabetes anymore. The excitement from the team of sick kids whose work is being published recently in a journal called Cell, with C-E-L-L, was the one that stood out the most. The recent study published in November 2011 Journal of Pediatrics, Maternal and Family Health documents a case of a 4-year-old child who had a terrific result stabilizing her blood sugar through chiropractic care. The patient was diagnosed with spinal subluxations in the upper neck. So there could have been an influence of nerve damage in the upper neck from the shift of the vertebra. And after a course of care, after 2 months, during this time, she had experienced a decrease in the hemoglobin A1C number. That's a way of monitoring how well your blood sugars are ranking, from a 7.2% down to a 6.5%, and did nothing more than that. Actually, they decreased the insulin down from 15 units a day down to 11 with this as well, all because the chiropractic care could have probably influenced the health of the nerve signals as the signals were going from the brain down the spinal cord to the pancreas. These results are often remarkable because of the influence, again, of your overall body health and the fact that we heal from the inside out. Nerve signals travel from the brain down the spinal cord and from inside out the body. So if you know people who are dealing with blood sugar issues, particularly hyperglycemia, which is high blood sugar, from either type 1 or type 2, they might be well served. Of course, we can't make any claims, but they might be well served to make sure that their spines are free of this condition called a subluxation. Again, that's where the vertebrae shift out of normal position. So I just think this is remarkable as we talk about the Awareness Month for the American Diabetes Association here, and highlighting that we could actually influence your health that way. So thanks for joining us here on this episode of Ask Dr. McCord. Remember to subscribe to our YouTube channel, and also log into our website at kenteastchiro.com for more information about Ask Dr. McCord, which can empower you to live healthier into your 80s, 90s, and 100s. Thanks again for joining us.